We're going to go back into session because we want to stay on clock. Very grateful that Mercedes Gonzalez has agreed to pinch hit for our colleague Anna Nichols on a really important talk, and that's Anticipatory Guidance for Children's Skincare. Let's welcome Dr. Gonzalez to the podium.
Thank you. All right, so sorry about that. That was a last-minute substitution, so we had to refresh the slides there. So we're going to talk about anticipatory guidance as it relates to children's skincare. The two most common topics that we really are talking to our families about is sun protection and insect bites, and how to prevent and against those, and what products to use in those realms. These are my disclosures. And so these are the common questions that parents often ask. Used to be that this is the question that would come up at the end of the visit for me as I was walking out, completed my treatment plan, and they're like, oh, what sunscreen, what insect repellent? So now I've really learned to address these questions right away, right from the beginning. As I'm doing my exam, I ask about this and I make the recommendation right then and there. So there's a lot of concerns, and this has been a theme in other talks earlier today about the headlines online, right? And so there's a lot of scary headlines relating to sunscreens directed at parents and a lot of these online parenting blogs. And so it's I think it's our job to keep up with those headlines and know what they're based in and how to translate that to our patients. The other very common question is, can I use sunscreen under 6 months of age? That's a really common question because we know here in Miami, swimming lessons start very early, and we're always out and about in the sun. And then the best sunscreen. And then insect bites, it's very common here in Florida and in my patient population. There's always concerns around DEET. And then the best insect repellent. So overall, the theme there is that parents want a specific recommendation. That's kind of what I've learned over the years, is really have a handout. And because if you can take the decision-making out, you really help parents. I know that firsthand being a mom. So these are some of those scary headlines that you might see. Your sunscreen might have a carcinogen in it, according to a new report. Benzene has been detected in popular sunscreens. FDA puts out a report with concerns over sunscreen chemicals and the trouble with sunscreens. The most dangerous sunscreens, and they're hiding in your beach bag. So these are pretty scary, and so it's important that our sunscreens are killing our coral reefs. So it's important to kind of, where do these headlines come from? They're based in something. So, and a lot of times there are scientific reports that they're based on. And so this was the most recent big headline with the carcinogen benzene being contaminated in multiple sunscreens that occurred, and it was published in 2021. It's ValueSure. It's an independent pharmaceutical review company, and it independently tests levels of carcinogens in different products. This company did detect some carcinogens in metformin and valsartan and other oral medications, and then recently tested over 294 sunscreens and found that 27% of the samples contained detectable levels of benzene, so 78 products, but over 200 did not contain the benzene. And the FDA has a limit for this known carcinogen. We know benzene is a carcinogen, and they have set a limit, and in several of the products, the detection was 3 times the FDA limit. However, there were a number of the sunscreens where it was not detected. It was tested and not detected. And really this was, when you look into the process of the testing, the result was that the benzene detection was a result of the contamination in the manufacturing process and not part of the formulation or related to degradation of ingredients in the formulation of the sunscreen. So that's really, it had to do with the manufacturing process. And so this led to numerous product recalls. And overall, in summary, what to tell patients. I think this headline has died down a bit, but if you get the question, really there is no evidence that sunscreens cause cancer, but lots of evidence that sun protection can help prevent it. And you really want to make a specific recommendation. And I've revised my list of recommendations to include ones that were tested and did not have the benzene in it, just in case. So just an update on the FDA's most recent proposed order on sunscreen. So this is not final just yet, but they have, of the 17 UV filters that are available to be used in over-the-counter sunscreens here in the United States, they have 2 of these filters that are designated GRACE, or generally regarded as safe and effective. That's zinc and titanium. There are two that are not GRACE, so there's data to suggest that they may be harmful, and so they are not to be used in sunscreens, and that's PABA and trolamine solicitate, and then also not regarded as not GRACE, right? So in this category of not to be used, sunscreen and insect repellent combinations. And then of the 12 remaining filters, there are, the FDA has concluded in this proposed order that there is insufficient data to determine whether it is GRACE or not. And so it needs further information. It's not because there has been data to show that it's harmful, but it's just there's not enough information right now to put it in the GRACE category. Other points that are proposed in this order include the listing of ingredients in the front panel of the sunscreens, just like it's required for insect repellents. The max SPF of 60, broad spectrum, they've specified a threshold, and then SPF, if you have an SPF of greater than 15, you also have to meet broad spectrum requirement. So that's also in the proposed order. And so once this order becomes final by the FDA, the industry will have 1 year to comply and make sure that all the sunscreens on the market are compliant with this order. So as of right now, only 2 of our filters are on that GRACE category. And then right now, industry is working to answer some of the questions that the FDA has. And so the FDA, the reason that these 12 filters are in that not GRACE category just yet is because there's insufficient evidence. And and it was also a result of this study where they use these UV filters under maximum use conditions. So basically they got 4 sunscreen products with varying concentrations of the different UV filters listed here. They had subjects apply them to a large, over 75% of their body surface area over 4 days. And so this is considered a maximal use trial. And what they did is they looked for detection of these chemicals, these filters in the bloodstream. And they found that even just after 1 application, they had detectable levels greater than 0.5 nanograms per milliliter. And then the majority of these subjects still had, for some of the chemicals on day 7, day 10, and day 21, they had still detectable levels after using them in that amount over 4 days. In addition, tape stripping still found the filters in the skin for some of the filters on day 7. And so because of this, and because the recommendation for sunscreens is that we're asking patients, families to apply this every 2 hours, right, on a large part of their body, and this study showing that it is absorbed, they need more. They're requesting additional information to determine the clinical significance of this systemic absorption. And so, very importantly in this study, though, they conclude that the results do not indicate that individuals should refrain from sunscreen use. Right, so there's nothing to show that it's directly carcinogenic or has some implication, but it is just present in the blood, and they need more information. So that's the reason that it's still in the not GRACE category. And so oxybenzone specifically, this one gets a lot of press. This is a short UVA and UVB filter, and it's present in a large percentage of the sunscreens in the U.S., up to a concentration of 6%. The concerns here are photoallergenic, environmental impact. We know that it's been detected in the oceans off of Hawaii and the Virgin Islands. And due to this study, it's been banned for sale. The sale of this has been banned in the Virgin Islands and in Hawaii. However, a large review showed that the levels that are harmful to coral reef are much higher than the levels that are actually found in the ocean. And this was a large review of many studies looking at this. And so really, compared to the amount in the real ocean, the levels toxic to coral are 1,000 to 1,000,000-fold greater in concentration. And so it's likely that the damage that we're seeing to coral is multifactorial, and really not just because of this chemical, this UV filter. Other concerns is about systemic absorption and the impact on human health. And oxybenzone, to put this into context, is a chemical that is also found in a number of other products. And its estimated prevalence of exposure in the general population is like close to 100% of patients or people have been exposed because it's found in many other things. One large study showed that it was detected in the urine of up to 95% of the people screened. And a recent meta-analysis of both UV filters, oxybenzone and oxynocetate, found that there were no adverse effects reported for male or female infertility, female reproductive hormone level, adiposity, fetal growth, child neural development, and sexual maturation. Few associations were found between thyroid hormone, testosterone, kidney function, pubertal timing, and should be investigated further. And so that was a large review of 32 studies published. Oxynocetate did not have any effect on thyroid or reproductive hormones. So the latest is this chemical in Europe has been completely replaced. It's not found in any sunscreens manufactured in Europe. The difference there is that Europe has 29 filters to choose from, and the US has 17 approved filters to choose from. So removing one, it was not so harmful and didn't really make a difference in the sunscreens available there, but it's not so easy here in the US. The current proposed rule needs more information to determine whether this is GRACE or not, so generally recognized as safe and effective. And there's a committee that's working on data to see if this can be moved to the GRACE category. So the next question is the sunscreen on my baby. And so here, the label says 6 months of age and younger in many of these packages, and it's really because of the ages of the patients or the subjects included in the studies and the trials that were done, and has nothing to do with anything magical that happens in the skin of a baby at 6 months of age. And so that is why that label is there. And so really, we know infant and toddler skin is structurally and functionally different than adult skin, and there's gradual maturation that happens over time. As pointed out earlier, there's a higher surface area to weight ratio, and so that makes them more vulnerable to percutaneous absorption of UV filters and other chemicals, but it also makes them more vulnerable to UV damage. So sun protection is increasingly important in babies, and so the best way overall to protect them. So when I get asked this question, it's not an absolute no, right? And so we explain that you can use the sunscreen, the mineral-based sunscreens on exposed area, but the primary form of prevention or sun protection is clothing and other things, shade, clothing, avoidance, and in exposed areas that are not covered, you can use the mineral sunscreens, and I make, again, a specific recommendation in that case. And this is a statement from the AAP website also stating just that sunscreens can be used on infants less than 6 months of age to areas of skin uncovered by clothing and hats if adequate shade and clothing are not available. So we always make that a point that the sunscreen is not your only line of defense there, and it should be really your last line of defense. The best sunscreen, so this is very often, so here I have a handout and I make specific recommendations after asking a few questions. What's the best sunscreen? The one that you're gonna use, I always ask what they're using now and if they like it or not. In older children and adolescents, you really wanna ask what is what's the issue, why they're not using it. Many of them, I think the most common answer that I get is that it takes too long. It's the time it takes. So the 2 seconds of rubbing in the cream is way too long for a lot of these adolescents. So anything that you can do in tips and tricks to reduce friction in the process, put it right next to their toothpaste, make it a pump. That's much easier than having to actually open a cap. And right, so those types of things. And a lot of times I also recommend on the way to school in the car. So usually you have like 5 to 20 minutes there. And other things is the vehicle, so greasy feel, so finding something, and some people might like that. So people with more dry skin may like a more greasy, oily. So you really want to explore the barriers and make a specific recommendation. So this is my handout here, and also added to the specific recommendation list was looking through that list of the benzene contaminated ones and making sure that it's not on my list. And again, sunscreen is just one part, very common misconception. People come in with a sunburn, they're like, but I use sunscreen, and really it's because they gave them a false sense of how long they could be out in the sun, the fact that they use a sunscreen of 100 SPF. And so sun protective clothing also super important. This is another tips. You don't want to do it right in the playground or right when you're getting to the pool or the beach. You want to model behavior and then allow the kids to participate. Right, so, oops, it didn't play, but that's my daughter putting on her own sunscreen there. Counsel at every visit and use some resources. So next would be insect bite reactions. That's another common concern, and we do a lot of anticipatory guidance in this realm as well. We're going to talk about DEET and insect bite reactions and the best insect repellent and the recommendations we make there. So insect bites in children, very common in young children. They're very itchy. They typically resolve in 7 to 10 days. And we know that they're also important vectors for disease. And this is also something that we see in lots of online magazine headlines. And they're very scary sounding, these viruses that are transmitted by insects. So there's a lot of questions regarding what's the best way to protect against insect bites. Patients, pruritus control, prevention, mind your P's. So to control pruritus, really, this is my go-to is a very strong, super potent topical steroid. I use fluocinolone gel twice a day. Occasionally, very deep, long-lasting ones. You can do an intralesional corticosteroid, antihistamine if it's a very large reaction or if there's multiple reactions. And then there's lots of over-the-counter options that are soothing. So normally I'll do a super potent topical steroid twice a day. Antihistamines if it's a lot of them, and then as needed, one of these over-the-counter soothing agents. So instead of scratching, they could apply these. And then, of course, we talk about prevention. And here are the insect repellent options that we have. These are the components of insect repellents that actually provide the repellent. And this is overseen by the government agency, the EPA, the Environmental Protection Agency. And so these are the ones that are registered and available to be used in insect repellents that are sold over the counter. We have DEET, picaridin, and the rest are listed here. And then there are several unregistered products, and they come in various formulations, as we know. DEET, been around for a very long time. This is something that's effective against a number of insects, provides a vapor barrier that deters insects from coming into contact with the skin, and it does work 4 centimeters away from where you put it, so you don't have to put it directly on the face. For the babies, I make sure to say that, not to spray it near the face. It can be used on clothing, and then in most situations, about 10 to 35% can provide adequate protection. Is it safe? Yes, with proper use. There's been numerous studies looking at this because this is something that I think has been a misconception that this is not safe in certain situations, but really in the context of a lot of these epidemic mosquito-borne illnesses that have been recent, it's very important that we still are able to use DEET, especially in pregnant women and young children. So there's been, all the agencies pretty much have on their website a recommendation that the use of DEET is recommended for the prevention of insect bites in children greater than 2 months of age and pregnant and lactating women. Picaridin is another one. So these are my go-to. DEET or picaridin are really the most effective. Here, the mechanism is that it's a vapor barrier, deters insects from getting close to the skin and biting. Can use on skin and clothing. It doesn't damage plastics or fabrics. The advantages is that it has a few advantages. It's a little bit more cosmetically elegant. It's odorless. It doesn't feel sticky or greasy. And there's been no reports of serious toxicity here. And here, the recommended concentrations is 5 to 20%. Oil of lemon eucalyptus is another one. This one's harder to find. It's only really available in 6 over-the-counter products, but this is another one that has been effective. And some patients may be drawn to this one because it does have more of the natural oil source. Citronella oil, this one is very popular. It's found in a lot of different formulations over the counter. It's one of the oldest mosquito repellents, but it's really not as effective. Most studies show inferior efficacy to DEET, and really the protection only lasts up to 20 to 30 minutes. So really the use of this one alone should be discouraged. Okay. And so what's the best insect repellent? Again, here, specific recommendation, go to the CVS. It takes some work on our part doing some investigation, but go to your local CVS and see what's available there and make a specific recommendation. In most situations, so the percentage is going to give you the hours of protection. The higher the percentage, the more hours of protection you get. In most situations, for a full day out, 10 to 25% of DEET or 7 to 15% of picaridin. The label now is required to be in the front with the ingredients. So it should be easy to see for patients. And so this is my handout, and I give specific recommendations here, and I make the point to avoid anything that has oils alone. Just a reminder, this insect repellent sunscreen combinations now is on the FDA's list of not generally recognized as safe and effective, and it shouldn't be sold or used over the counter. When you're applying both, you want to apply sunscreen first and then repellent over the top to reduce the transepidermal penetration of the active repellent ingredient, and we want to avoid the combo products. So again, the repellent, just like the sunscreen, is just one part of the protection, and so that's an important education point. It's really just one part. It's clothing. It's you can put permethrin into your clothing for more prolonged exposures like camping trips, avoiding clothing with bright colors or flowery prints, scented soaps, remove any habitat, so standing water, and then the times of the day that they're more active is going to be sunrise and sunset and early evening. If you want to use this as a nice tool on the EPA website to find a repellent, if you're going to an endemic area with certain ticks, you can actually put that specific tick in the drop down and find the best repellent for that. And so that's, in summary, we really should just keep up with our scary sounding online headlines. And right now there's 12 filters that the FDA has asked for more information before they can be moved to the gray status. It's important to make specific recommendations for our patients. And in terms of insect repellents, DEET and picaridin are really the most widely available and the best protection for bites. So thank you for your attention. I'll take any questions.